Welcome. In this video, we're diving into sinus node dysfunction, also known as sick sinus syndrome. We'll explore what it is, what causes it, how it affects your heart, and the available treatments. So, what causes sinus node dysfunction? The most common cause is scarring or damage to the sinus node itself. This damage can be the result of aging, underlying heart diseases like coronary artery disease or heart failure, high blood pressure, inflammatory diseases like rheumatic fever or endocarditis, certain medications, or even genetic factors in rare cases. In some instances, the cause remains unknown, which we call idiopathic sinus node dysfunction. To understand sinus node dysfunction, we need to talk about the sinus node. It's your heart's natural pacemaker, located in the right atrium. It generates electrical impulses that trigger each heartbeat. In sinus node dysfunction, this pacemaker malfunctions. It might fire too slowly, too quickly, irregularly, or sometimes not at all. This disruption in the heart's natural rhythm can lead to a variety of problems, affecting blood flow and overall heart function. Sinus node dysfunction becomes more common with age. It's estimated that it affects a significant number of older adults, with prevalence increasing after the age of 50. It's not considered rare, but accurately gauging its precise prevalence is difficult because many people with mild symptoms may not seek medical attention, or the condition might be masked by other underlying heart conditions. Now, let's discuss the telltale signs. Symptoms can vary widely from person to person, and some people may not experience any noticeable symptoms at all, especially in the early stages. However, common signs and symptoms include fatigue, dizziness or lightheadedness, fainting or near-fainting spells, shortness of breath, chest pain or palpitations, and confusion or memory problems. These symptoms arise from the brain and other vital organs not receiving sufficient blood flow when the heart rhythm is irregular. Diagnosing sinus node dysfunction involves a thorough evaluation. Your doctor will start with a physical exam and review your medical history. An electrocardiogram, or ECG, is a crucial tool to record your heart's electrical activity. However, since the dysfunction might not always be present during a brief ECG recording, a Holter monitor, which records your heart rhythm over 24 to 48 hours, or even longer-term event monitors might be used. An electrophysiology study, or EP study, can be performed to directly assess the sinus node function and identify any abnormalities in the heart's electrical pathways. Sinus node dysfunction presents in several forms, each affecting the heart's rhythm differently. Sinus bradycardia means the heart beats too slowly. Sinus arrest is a pause or complete cessation of the sinus node's electrical activity. Tachybrady syndrome is a combination of slow and fast heart rhythms. Atrial fibrillation or atrial flutter, types of fast heart rhythms, can also be associated with sinus node dysfunction. These variations influence the choice of treatment strategies. Treatment for sinus node dysfunction focuses on alleviating symptoms and preventing complications. If symptoms are mild and infrequent, monitoring may be sufficient. However, if symptoms are bothersome or impacting daily life, a pacemaker implantation is often the most effective treatment. A pacemaker is a small device implanted under the skin that sends electrical signals to the heart, regulating its rhythm. Medications can be used to manage specific symptoms or related conditions, but are not usually the primary treatment. Managing underlying conditions, like high blood pressure or coronary artery disease, is also essential. While it's difficult to entirely prevent sinus node dysfunction, especially when it's age-related or genetically linked, you can take steps to reduce your risk. Managing underlying heart conditions, controlling blood pressure, maintaining a healthy lifestyle, including regular exercise and a balanced diet, and avoiding excessive caffeine and alcohol consumption can all contribute to better heart health. Always discuss any medications you're taking with your doctor to see if they might be contributing to the problem. The prognosis for individuals with sinus node dysfunction varies depending on the severity of the condition and the presence of other underlying heart problems. With proper diagnosis and treatment, most people can lead relatively normal lives. Recent research is focusing on improving pacemaker technology, developing less invasive implantation techniques, and exploring potential gene therapies to address the underlying causes of sinus node dysfunction in the future. We are learning more all the time, and the future looks bright.